All right, everybody, welcome back to another episode of the Off the Court podcast. We had a couple weeks off, but we're back. We're excited, and I've got a really great guest today. Again, thank you to ESPN Honolulu again for this amazing opportunity to bring on experts in different fields and athletes to talk about mental health, talk about nutrition and recovery, and just kind of make the whole topic a little bit more of a comfortable conversation. So today I'm joined by Dr. Peter Zhu. He's currently a physical therapist. He does have some athletic background in rowing, track and field, recreational surfing. He's a gym rat and a foodie, just like me. And he loves working with active individuals, whether it's weekend warriors, just people trying to get in good shape, or professional athletes. He's also got a special interest in orthopedic and sports rehab. He's 30 years old. He went to undergrad at UCSD, and he did his doctorate at the University of Southern California. So, Peter, welcome to the podcast.
Thanks. I'm happy to be on.
Sweet. Yeah, I'm really stoked to have you on the podcast. You know, it's so cool to have another expert that we haven't had yet. You know, we've had some really cool athletes come on and do the podcast, you know, some Hawaii athletes. And I think it's great that you're a local guy too. You know, the people watching the podcast, they love to see that as well. And, you know, having an expert now in physical therapy, you know, we've had a nutritionist, we've had a couple of people kind of in the psychology field, and now we get another piece that we're missing, which is kind of sports rehab, recovery, performance, and all that kind of stuff. So I'm going to start it the way that we've been starting all these podcasts so far. And I just want to give you the floor, man, to talk about your time as an athlete, the levels you competed at, any mental health issues, struggles that either you went with, maybe a teammate went through, talking a little bit about how that felt, how you tried to adjust to it, maybe things you did that really worked, maybe things you did that didn't work at all. So yeah, the floor is yours, man, whatever you would like to talk about.
Yeah. So, I mean, my kind of journey to becoming a physical therapist was pretty standard in terms of, you know, I did a lot of sports growing up. I was very active. I went through many injuries and had a lot of experiences with some great physical therapists, which kind of led me to where I am right now. As a little background, I think when I was 6, that's when I started playing basketball a couple hours a day in my backyard, just like shooting hoops, playing with my cousins. I started getting really interested in fitness at a young age, just because, you know, everyone around me, we loved being outdoors, we loved playing, and it was always something I wanted to get better at. So that's kind of where my athletic kind of journey started, just playing basketball in my backyard. And then I noticed, you know, when we would play tag or like have races at the playground at school, you know, I would have this kind of competitive drive in me to try to be the fastest, the strongest. And that really got me into the competitive part of, you know, athletics. So from there, in middle school, I did track and field for all 3 years, placed pretty well in my events, which I did the 4x1, and I also did the 400-meter dash. Unfortunately, at the end of middle school, I experienced pretty disabling tendinopathy of my patella, which is very common in many jumping athletes.
Yep.
At the time, I didn't even know what a physical therapist was. I kind of just went to my PCP, who was like, okay, take some, you know, ibuprofen, don't run, and you should get better. At the time, you know, didn't know anything better. So that's what I did. But me being stubborn, I didn't really take the don't run advice and
Yep.
I obviously kept running. But yeah, without kind of proper rehab, that didn't set me up too well for high school. So I did actually stop running for a while in high school, and I decided to try out rowing, which actually I call it rowing, but it's because most people don't know what dragon boating is. So dragon boating is another form of rowing. It's also a team sport, and except that the paddling technique is a little different. It involves a little bit more overhead motion. So that was a really great experience to me because it was my first time being in, I guess, organized team sport. And, it wasn't aggravating my tendonitis in my knee because it's primarily upper body. So I did that all throughout high school, and it was my goal to try and do that for college as well, because we did actually have a team for UCSD. But somewhere throughout my, career in high school, I had another injury. Um, I didn't know what it was at the time. It was pretty much just shoulder pain, and I chucked it off to, I was doing a little bit too much. So I tried to dial it down. But the problem ultimately stayed with me, and it ended up being the case that I didn't do rowing in college. So 2 times already, kind of injuries had set me back in terms of what my sports goals were. But not to say, that didn't stop me from being active. I was still going to the gym often, lifting weights, running just for fun, and just trying to keep, pain in check. And it wasn't until, I want to say, my 3rd year in college where my pain had gotten to a point where it was really limiting me from being able to even like walk down a hill. So that's when I finally decided to see a physical therapist. And he was a really good one who kind of helped me address the root causes of my issues. And that's what really kind of sparked my interest in performance optimization, as well as like rehab and preventative rehab. Those are probably at least preventative rehab is what I'm most interested in, because of my experience having gone through injuries and not having great outcomes, trying to treat it on my own. So I believe that, if you can identify any of, your weaknesses or any kind of contributing causes before issues arise, then I think your outcome will be much better should you, experience an injury later on. But yeah, I'm not sure if I went on a little tangent there, but that's kind of my story of how I got to where I am right now. I don't play any organized sports right now, but like I said, I'm a recreational surfer, gym rat. I like to do a lot of cross training. So
yeah, no, I think that's great, because I think when you talk about the world of athletes, I think injuries are maybe the top of kind of stressors that can happen, being taken out of your sport. Like you said, being prevented from continuing that sport in college. And, especially when you get to the professional level, then it can inflict pain on your career at that point.
Yeah.
It's definitely one of the biggest, I would say, maybe if not the biggest, is, injuries and kind of the mental health side of those, which is something that in the past, and I think even now, is overlooked quite often.
For sure. And now that you mentioned injuries and being, put out, I actually had a shoulder surgery 2 years ago. It was a torn labrum, and it was actually due to my old injury when I did rowing that was never properly diagnosed. So I finally saw an orthopedic surgeon who, did an MRI on me. It was a posterior labral tear. And I decided at that point I had been rehabbing it, or trying to rehab it, for a couple of years now, even with my PT knowledge. And I ended up getting surgery, and it put me out for a solid 7 months or so, where I basically couldn't do anything with my arms, which for me was huge. And this was also during the pandemic, which, is a stressor itself.
Yeah.
So, that whole episode was a big learning experience for me, because it really it gave me perspective in, where my patients and my clients' mindsets are when they are kind of put out from their sport or their activities that they love to do. So, I'm not going to lie, I did fall into a little slump, especially that first 3 or 4 months where I couldn't do anything. And, in the pandemic, I couldn't go to the gym. I didn't have my own home gym. So I didn't really do much except lay down on the couch, which ultimately made me feel much worse. But, when rehab started going, when I was allowed to move my arms, things started to pick up a little bit more. And just from my experience working with other athletes, or just even everyday people who experience injuries and, can't do the things that they want to do, I kind of talked myself into, okay, you got to get the ball rolling, right? You can't just not do anything and just kind of focus on the road ahead.
Yeah, no, absolutely. And I think in general, I think that the pandemic gave a lot of people who had maybe never really experienced any sort of anxiety, depression, at the very least, gave them a lot of empathy for people that kind of experience that stuff on a daily basis. And especially for you, I think it gave you kind of a look into your patient's eyes, which I think is really nice. Like you said, being taken out of your daily activities and the things that you love to do and the things that you do. And trust me, I understand like the whole, I get anxiety if I don't go to the gym for a week. And I totally know that feeling of, being put on your butt for 3-4 months at a time and not really being able to, do your normal day. So yeah, I think that's great. And then, so now I just want to jump into some questions. Like I said, I think it's such a pleasure having an expert like you on. So I definitely want to do a nice segment just talking about sports rehab. And then towards the end, we'll get back into the mental health stuff. So first, I just want to ask, you mentioned I guess I mentioned in the intro that you really love working with active people. You love working with athletes. What is it about working with active people that you enjoy so much?
I mean, there's a lot of things, but the first thing that comes to mind is motivation and drive. Active individuals want to stay active, right? So when they experience an injury or an issue that's preventing them from being able to do what they want to do, they're highly motivated to do something about it. So that makes my job 1,000 times easier because I don't have to motivate them to want to do their rehab exercises. They're actually bugging me like, okay, what else can I do? What else can I do? And it's fun because they challenge me, right? A lot of the people that I work with, they, are in sports or activities that I've never done. Like I've never played baseball. I've hit a volleyball a couple times, but other than that, I don't really do too much, or I'm not really too aware of the demands of their sport until I get to know them, until I talk to them and ask them, okay, like, what movements are you having issues with? Like, what kind of training do you do? And it just kind of challenges me to grow as a clinician working with these types of people because they ask hard questions. And, it's on my end to kind of do the research, to ask the right questions, to do the right assessments. So yeah, that's why I love working with active people. I also like working with, everyday people who may not have been exposed to too many sports, because oftentimes they start to enjoy exercise as well. So for all my listeners out there, I don't discriminate.
No, I think that's great. And I think, for an everyday person, when they come and do physical therapy and then they can get rid of some pain that they've had forever through exercise, now that, kind of changes their relationship with exercise too. And maybe that is the spark that they need to become a more active person. So that's awesome. So you talked a little bit about when you were talking about your own injuries. And I think a lot of athletes kind of share the whole like stubbornness, I think is a good word of I can fix it myself. I'll just pull up some YouTube videos and how to get rid of jumper's knee or how to get rid of, tennis elbow and all these different things. Have you noticed a change in athletes just being a little more willing to kind of jump into physical therapy? Or do you still think that stubbornness is still there?
I mean, it's hard to say because it's different for everyone. I mean, me personally, as a physical therapist, I was still stubborn.
Yeah.
In the sense that, I thought I could fix everything myself because I have the knowledge of a physical therapist. But, after unsuccessfully treating myself for 3 years, I saw an orthopedic surgeon who basically told me, this isn't something that you can fix with exercise. It's a mechanical deficit that, if you truly want to recover to 100%, only surgery can fix. And that's not something that I like to hear, obviously, as a PT. But, in hindsight, he was right.
Yeah.
Thanks, Dr. Khan. My shoulder's 100%. Thank you. But, when it comes to athletes are inherently very motivated to improve at their sport, to get stronger, to get faster, right? So, it's natural for them to do a lot of their own research and to kind of take things into their own hands. So I have worked with a lot of athletes who, will say, oh, well, I've already kind of done A, B, and C. And they're kind of a little skeptical of what else I can offer. But then also meet athletes that, are just come in with a really open mind. They may have done a little bit of their own research, but ultimately they're still very receptive of, my point of view and kind of what I can bring to the table. So yeah, I think it depends on the person, and I can't say I can speak to any trends. It hasn't been obvious for me, at least.
Yeah, for sure. So going in now to like a little bit more specific of your experience training with athletes, what are some of like the biggest training mistakes that you notice among athletes? Like they come into you, say, I've been doing this, and you're just like, don't do that anymore.
I usually try and actually not say don't do something, because I find that it usually rubs people the wrong way. At least that's how I felt when my doctor was like, stop running. I was like, why? That's what I do. But yeah, I mean, the most common error I see in people that are coming for rehab is that they do too much too soon. So, in rehab, especially if there's some sort of, tissue damage, you can use, for example, a fracture. Okay. So for a fracture, you have to respect the normal healing time frame for that fracture, right? Generally speaking, it takes about 6 weeks for fractures to heal, and then longer for you to regain your strength, balance, flexibility, etc.
Mm-hmm.
So oftentimes, I'll be working with an athlete and they say, okay, my pain is feeling a lot better. It's almost not there anymore. I think I'm just gonna, go for it. So they'll play like, full game, 100%, go training like 5 days a week. And then they'll come back with either the same pain that they had or secondary issues as a result of doing too much too soon. So, tendonitis or tendinopathy, which is the chronic version of that. So, whenever I'm talking to my patients, the first thing I tell them is make sure you're being smart about training and smart about rehab. Think about small incremental progressions in your exercise so that you can accurately assess whether or not you can tolerate it, right? So I think a lot of athletes in particular struggle with this because, like I said, they're used to bringing their A game and like putting in their all. So I often do have to kind of slow them down.
Okay, awesome. No, and I think that was definitely the most difficult thing for me going through injuries and definitely one thing I learned was, you have one injury, you try to come back too fast, and then the injury comes back. And it's like, all right, this time I really just need to take it slow, no matter how painful it is, no matter how much, how many more weeks it is until I fully return to sport. It's better always to come back 100% than come back at 95% and then go back down to 0 because you just weren't there yet. So I think that's a great piece of advice too, is, not being afraid to go slow through rehab. It's about getting you back to where you want to be. And there's kind of only one path to get there. If you go too fast, then you risk more injury.
Definitely. Yeah.
Okay. So I know you mentioned a lot about preventative exercise and kind of, I guess, resilience training, injury prevention training. And I know that this is another thing that I think for me as an athlete, I've definitely noticed this grow a little bit more. I think when I was in college, it was very much like meathead, like let's get strong, let's get big, let's jump high, let's run fast. And I think that there's so much more of an emphasis now, especially now that I'm a professional, but even looking back at some colleges now, guys are just paying way more attention to their bodies. They're way more in tune with their bodies, doing more preventative training, doing more mobility training, all these different things to help their bodies. how much time per day or maybe per week do you think is the minimum for, let's say, a college athlete to incorporate some sort of injury prevention training?
Yeah. So, well, first let's kind of define what recovery is. So, at least in my terms, I define as recovery as time set aside to either work on, you know, accessory drills, maybe like work on strengthening some of the stabilizing muscles that are weak, right? Or work on mobility exercises, because when you're training, your muscles shorten, they get real tight, your joints get a little stiffer, and you get delayed onset muscle soreness, which can, impact your or how soon you can get back to training. So when I talk about recovery, that's what I'm talking about. And then in terms of preventative exercises, so prehab, I define that as exercises to address any sort of musculoskeletal deficits that, personalized ones that can put you at increased risk for injury. So to answer your question about how frequent, I would say that would depend on what level of sport you're playing, but also how often you're participating in those activities, right? For my weekend warriors who may be really busy with life and their kids, who only go on daily walks, and then maybe on the weekend they do CrossFit or something, then I'm not going to say do prehab every single day. Mm-hmm. Versus my competitive athlete who plays professionally, who trains like 3 to 4 hours a day, then prehab and recovery are much more important and need to be done more frequently, right? So there's no one size fits all question. You do need to look at how often you're training, how hard you're training, and make the judgment call from there. But in general, the more you train, the more you have to engage in prehab and recovery.
Yeah, absolutely. So what are some good pieces of advice that you would have for someone who's just beginning to train, but they kind of tell you like, I'm just getting into it, but I really want to like train seriously. So what are some pieces of advice, maybe with the recovery part, with the prehab, or maybe just strictly like their performance training? How often, how much time should they spend? Like, I know you said, depending on how much they want to train, that's, you should add more and more recovery prehab stuff. But what advice would you have for someone who's like just getting into it?
Yeah. So my advice is get an assessment and figure out what your weaknesses and deficits are. Because without that knowledge, you're kind of shooting in the dark. And that's not to say you need to, see a rehab specialist, but there are some, for example, like self-tests you can do for like functional strength tests, for example, like how long can you hold a plank? Can you get into a deep squat? Things like that. So when you're conscious of what your limitations are and what your movement deficits are, then you can get smart about creating a program for yourself. In my opinion, it's obviously always best and ideal if you can get assessed by a trained professional, but sometimes you don't have access, or you don't have the resources to, but there's still stuff that you can do, right? So my advice: be smart about what you're doing and what you're programming for yourself. Don't be afraid to ask questions, maybe to your teammates, your peers, other health professionals that may know more than you. YouTube University is a great resource, but it's not always, you're not always going to find super relevant information for you specifically. So the assessment part of it is super important.
Awesome. And then, so that was the advice for someone just beginning. What advice would you have for, let's say, a college athlete that's wanting to go pro, and they really want to step up their training? They want to increase their vertical or increase their 40-yard dash time, or, anything like this. What advice would you have for someone who kind of already is a very, functional athlete wanting to push and get to the next level? What advice would you have for someone like that?
My advice for someone like that would be definitely seek out a professional who, one, knows your sport, and two, is skilled enough to break down whatever task you're trying to achieve, jumping higher, running faster, into their component parts. What I mean by that is, okay, we can use an example of someone who wants to increase their vertical. Well, first you have to know what muscles are important for increasing your vertical, right? Your quads, your calves, your glutes. And then secondly, you need to know what types of exercises will help you recruit those fast twitch fibers, which are the muscle fibers predominantly responsible for that quick burst of explosive energy as you see in a vertical jump. So again, it comes down to being smart and deliberate about your training. And, unless you have a degree in biomechanics or a DPT or, any number of, movement kind of specialties, then you may not have the knowledge yourself to, safely bring yourself to your desired level. So, always seek help. And even me, I've been practicing for a few years. I have a lot of personal experience under my belt in regards to training, but I'm constantly learning every day. I actually, I don't even call myself an expert because I don't think you can truly be an expert at anything, because there's always someone that knows more than you. There's always more things to learn. And, you got to put your ego aside sometimes and know how to reach out for help.
No, yeah, absolutely. And I think that's a perfect segue to get into talking a little bit more about mental health, because I think in general, ask for help is just a phenomenal piece of advice for any athlete in anything that they want to improve. If you want to improve your nutrition, ask an expert for help, ask YouTube University for help, ask Google for help. If you want to improve your vertical, if you want to, bench more, if you want to do any of these things, if you want to get rid of tendinopathy, ask for help, and especially mental health too. And I know it's still a very big stereotype for athletes to not really want to ask for help and to kind of, like you said, it's tough sometimes to put the ego aside and ask for help. But I think you just got to do it. Sometimes you just got to bite the bullet if it's what you really want. And if, as athletes, the one thing I think all athletes have in common is the desire to perform and the desire to keep improving. That's the best way to do it. If you're lost, then you got to ask for help. You can't just keep, doing the same thing over and over and over and expect something else to come out of it. So yeah, I think asking for help in general, great piece of advice. So now let's talk a little bit about kind of the mental health side of injuries, especially. Is there anything that you notice, like someone comes right in the door, they have an injury, and is there usually any indication that you can get, okay, they're having a pretty tough time mentally with this, or they seem to be doing really well mentally with this? Is there usually an indicator, or is it usually pretty kind of not so black and white like that?
So some people are very good at hiding what they're feeling, myself included. So, it can be sometimes hard on the first session to build enough rapport with the person in front of you for them to really open up. That's one of the things I love about PT is that compared to other health professionals, we probably spend the most one-on-one time with our patients. And I really think that's to our advantage, because, we really get to know who we're working with, and kind of just, walk them through their journey. So as a PT, you wear multiple hats all the time. Yes, you're a physical therapist, but oftentimes, they talk about their home life. They talk about, how school's going. So in a sense, you also become a therapist, like a mental health therapist to them, right? They open up to you. And, although I'm not trained as a mental health coach, or, I don't have any training in psychology, you pick things up over time in terms of how to recognize when someone may, be dealing with anxiety or depression or stress, which I'll argue that most people who come into rehab deal with, right? They're experiencing a life-changing event where they can't participate in the activities that they normally participate in, whether it's, being a new mother not being able to hold their child because of a rotator cuff injury, or a high level athlete who, has a broken femur. Everyone kind of comes in with some anxiety about what the future holds for them. And, it's my job as a physical therapist to guide them through the rehab process, but also, be there for them mentally and be a source that they can confide in and, talk about their struggles. And it's interesting because there's a lot of literature that shows that psychosocial factors have a big prognostic factor when it comes to rehab. What I mean by that is, if you're my patient and you come in and you have a lot of life stressors, or like you're chronically depressed, even if you have the same exact injury as, person B over there, who may be in a better, mind state, the person with depression, anxiety is predicted to do much worse than the person who isn't going through, mental health stressors. So part of a successful rehab program is addressing those psychosocial aspects, right? Making sure that, you're telling them, don't just stop moving. Active recovery is good. If you can't swim, but, go for a walk. Make sure you're not retreating from your friends and your other hobbies just because you're injured, because, those are all factors that play a huge role in how well you're going to recover.
Do you notice yourself, especially I think in more recent, maybe months, years, especially during COVID, do you find yourself talking about specifically mental health more often?
Definitely. The pandemic really wreaked havoc on a lot of people's mental health, because, we were isolated and we lost that in-person connection with people. And I'm thinking about people specifically like team sports who, couldn't be with their teammates. That plays a huge role in your mental health. So coming out of the pandemic, people are getting more comfortable gathering again, but I think a lot of people still have, lingering effects from being isolated from their peers. And when you combine that with with having an injury, which also affects obviously your mental health, those two things can have compounding effects. So, that's something that I've always been really attuned to, just because of my own experience with anxiety and depression growing up. It just made me a more empathetic person, and I'm able to, kind of pick up those signs and have a talk with them about it, without making it, accusatory and like, you have anxiety, you have depression kind of thing. So yeah, it's definitely something that I keep a keen eye out for.
Yeah, absolutely. And I think it definitely is changing. In my own experience, I remember I had a foot surgery about, I think it was like my sophomore year in college. So this was like 2016 or something like that. And the whole process was kind of very just physical, like, yep, let's do this. And then you'll be back in sports. I was like, okay. And then, my more recent injuries, you go in and now they have like a questionnaire of anxiety and depression. And I thought, this is actually really cool, because I think for them to see that, and, maybe then they can recommend, hey, maybe while you do physical therapy, maybe it's a good idea to, supplementing that with some sort of like, psychology therapy, or, a therapist or a sports psychologist, or, a mental performance trainer and something like that. So I think it'd be really cool to see kind of, maybe not somebody like you just getting a second degree, but, kind of combining the two forces. And it's like, okay, when you start physical therapy, we also recommend, maybe if you think you need it, seeing a therapist as well. And, a mental therapist, a mental health therapist.
For sure. Yeah. I think I definitely see a positive trend a lot of across, the medical field, about clinicians being more proactive about, referring out when we do recognize, signs and symptoms of mental health issues. I think, at least for PT, there's been a large push towards really listening to your patients, right? A lot of times, or I guess, I've had PTs in the past where, like you said, it was very physical. Like, you have this problem, you're going to do this, this, and this. But they didn't really ask what my goals are. They didn't ask, what I was going through, or like really just anything deeper other than how's your pain, right? So it's important as a therapist, as a physical therapist, to really ask questions, get to know your client, build that rapport, and you'd be surprised. They'll start telling you about their childhood traumas, which again, that's not necessarily something that we're trained to be able to coach them through, but just having that knowledge, I'm like, oh, okay, I think actually you might benefit from talking to a mental health specialist, or you might benefit from opening up to other friends or family or loved ones about this, as opposed to just me. I'm glad you feel comfortable enough to open up to me, but I do think you probably feel better and you'd find benefit just from opening up to your peers as well.
Yeah, absolutely. I think it's that sense of trust. I think like someone comes in to see you to fix their knee and it's working, and all of a sudden there's kind of like, oh, I really trust this guy. I really want to like tell him about other stuff going on. And I think in general, as athletes, like you just got to find more and more. You can never have too many people that you trust enough to have those difficult conversations with. So I think that, I think that's a great piece of advice. And I think that's awesome, that there's physical therapists like you that aren't just, do this at home and you should be good. There's so much, and you've had the experience as an athlete and as a physical therapist now. There's so much more that goes into it than just physical stuff. Like you said, given two people that have the exact same injury, the person that's got their stressors and mental health in check is going to do way better. And I think anybody that's going to physical therapy wants to get better. So, that's just another component that I think needs to be addressed a little bit more often.
For sure. Yeah.
So last question, it's a two-parter. What advice would you have for a non-active person? And this is in terms of mental health, and obviously, the physical part as well, because I know that that's what you're specialized in. A non-active person comes into you for help that has an injury. What is kind of the first piece of advice, mental health wise and also training wise, that you would give to that person?
Yeah. So for a non-active person, at least for like mental health, my biggest advice is stay active. I know oftentimes, people like that come to me with, let's just say, a shoulder problem, and they're like, okay, my shoulder is really bothering me. I can't sleep at night. I don't want to do anything. And that makes their issue worse.
Mm-hmm.
When they don't do anything, they lose a sense of control and self-efficacy. They feel like their injuries kind of taking control, right? So again, that feeds into the psychosocial aspects of your rehab prognosis. So encouraging them to stay active, whether that's walking, climbing up stairs, that can play a huge role in your mental health as well as your rehab prognosis.
Yeah.
The second part of your question, I'm sorry, could you repeat that? The physical aspect?
Yeah. I mean, I think you kind of touched on it, is be active. And I think, it's difficult to say to someone who maybe just sits in an office desk chair 5-6 days a week and doesn't really do much on the weekends, to say, hey, you need to be active. But I think that there's also that mental health piece there. It's like, well, if you want to sleep better, then you got to be active. Or if you want to be able to hold your child without pain, then you got to figure out a way to be active. And like, here, I'll give you the tools to do it. But, at the end of the day, it's you get out of it what you put into it.
Right. I mean, another way to approach, talking to someone who may not be active is to start small. Oftentimes, people that aren't active are very intimidated at the thought of going to the gym or exercising because, one, they don't know what they're doing, or, they may feel embarrassed about other people watching them. So kind of meeting them where they're at can go a long way. So, you're talking about the desk worker who sits all day, 5 days a week. and doesn't do anything on the weekends. Well, if I set a goal for them where like, okay, each hour I want you to stand up and, take a few laps around the office. And then once they kind of incorporate that and they're like, okay, this is doable, then, you slowly increase that. Same as when I'm trying to reach a particular exercise goal, right? I'm never going to say, okay, go sprint, a mile and you'll be good. I would start off with go, walk a mile and then speed walk a mile, right? And then, kind of take it progressively from there. So you always got to meet people where they're at.
Yeah, absolutely. And then, so the second part of the question is, now let's talk about somebody who's just very just gung ho, like let's get after it. A professional athlete comes in there with an injury, says, hey man, I want to get back to 100%. I need to get back to my sport as soon as possible. What advice do you give them mental health wise, and then also training wise?
Yeah. So this is one of the most difficult parts of working with athletes. And I'm sure from personal experience, is, they like to perform and they're very eager to get back to where they were or better, right? So, the first thing I do is acknowledge their concerns and acknowledge their needs, right? Let them know that I understand, you really want to get back to your sport. This is your career, you're getting paid for this. Or maybe, you're in college and, you got a scholarship for this and your scholarship kind of depends on you being able to play. So I acknowledge how important it is to them. And then I also talk about, realistically, this is where you're at. This is where you want to be. And this is approximately how long and what you need to do to get there. So setting expectations early on is super important. So one, they're not disappointed. They know exactly what they need to put in, how long it's going to take. And then two, I guess there's no two. I kind of answered that with one. So yeah, acknowledging what they're saying, meeting them where they're at, and then setting realistic expectations. In terms of training, I mentioned it earlier, but you always want to be very purposeful and also progressive with the way that you are training. So you don't want to take big leaps just because one day you feel really good and you're like, my pain is very minimal. I had a good game. I had a good practice. I think I can go for it. So that's kind of where our job lies, to really keep them in check and remind them that, hey, you got to kind of respect the natural healing timeline of whatever injury that you present with. So, they don't always like to hear that, but it's our job to educate them on why that's important, because ultimately we share the same goal. We want them back on we want them back on their A game.
Yeah, exactly. And I think, yeah, that just is definitely a testament to the stubbornness of athletes is, oh man, I feel good today. Like I'm going to go do everything that I was doing before I had an injury. And it's like, that's things like that are the reason that you're injured in the first place. And I think it's definitely a difficult concept to understand. Especially me as an athlete, I've gone through, you listen to my whole story, I've gone through various injuries and continuing to kind of just slowly improve on those issues. I mean, even still today. And it's so tough, it's so tough. Like one day is like, all right, I feel like I can jump today. Like I'm going to go jump 100 times and I'm going to go back to training. It's like, all right, you've got a little while before season. Like it doesn't have to happen today. And it's definitely, it's one of those things that a lot of athletes just kind of have to learn that the hard way, unfortunately. But I think if you're especially an athlete who wants to perform, even before you ever get injured, it's important to know these kinds of things, the prehab stuff, the understanding that you have to go small increments and you have to go slowly if you want to get back to where you were. I think a great analogy I think I heard from I think it was one of the physical therapists that I've been working with is, you bring somebody in who wants to lose 60 pounds and they do it in like a couple of weeks. I think it's like 90 to 100% chance that they'll gain all that weight back again. And it's the person that loses 1 pound a week and then 2 pounds a week, and, slowly over months and months and months, and develops that kind of lifestyle that is sustainable, that sees lasting results. And I think it's the same, and, correct me if I'm wrong, but I think it's the same in coming back from an injury. There's tons of things you can do to take the pain away, but at the end of the day, if you don't kind of address root causes and improve those imbalances or weaknesses that you have, then you're always going to be at risk for injury again.
Yeah, 100% agree with that.
Awesome. Well, Dr. Zhu, thank you so much for coming on, man. This was an awesome conversation. It was really special to have an expert like you talking a little bit about not just mental health, but especially, the recovery stuff, the prehab stuff, the performance stuff. I think that's just, as an athlete, we just eat that stuff up. Like I said before, we're athletes because we want to perform. And that's, I think, one thing that just about every athlete has in common is the determination to just kind of be our best self, perform at a high level. And I think that there's so much more incorporated into that, which is one of the main reasons why James and Faye and I, founded Off the Court. Was there's such a big component to what you're doing while you're not in the gym, while you're not on the court, that directly influences your performance. How you eat, how you recover, how you prevent injury, how you manage your stress. There's such a huge component to, if you want to be at the highest level and your best self, you have to, there's the obvious, you have to perform well in the gym, in the court, in front of your coaches, but there's so many other aspects in life away from that kind of the normal training environment, that when taken care of, when you manage your stress, when you have an injury and you go to physical therapy instead of just trying to get through it, those are the things that make great athletes. And I think, again, thank you for coming on. I think it's awesome having another perspective on that, and even myself learning a little bit more, and talking with you, because obviously I have a lot of experience going through injuries as well. And it's always great to kind of just talk again about the concept of, you got to go slow. It's small increments. It's not one day you feel good, so then you're done and then you're good to go and back into your sport. It's a slow process, just like anything is. So yeah, man, thank you so much. To all the listeners out there, definitely go follow it. Dr. Peter Zhu on Instagram. It's at Dr. Zhu Physio. Dr. Zhu Physio on Instagram. He posts a ton of informational stuff. It's Instagram, so it's free. It's, go give him a follow. I love his content. He talks all the time about like bulletproofing and prehab and recovery stuff. So if you're an athlete and you're interested in just continuing to learn more and more about your body and biomechanics and increasing your performance, definitely go give him a follow. So Dr. Peter Zhu, thank you, man. I really appreciate you coming on.
Thanks, Tal. It was a pleasure.
Awesome, man. And thanks again, ESPN Honolulu, for the opportunity, and all the listeners out there. We'll see you guys again next week for another episode of the Off the Court podcast. Thank you.